Hey, I'm Scott Marquardt, and just in case we haven't met yet, wanted to introduce myself. Please excuse my background around me here today. I'm sitting in my home office as we are under the voluntary quarantine for COVID-19, and I want to take a few minutes to tell you about what COVID-19 is and how this virus is going to affect you and everyone you know and every company around you. If you're not already under a quarantine, then you will be soon. So please listen carefully, and we will find some ways to protect you, protect your family, and protect your clients. So COVID-19 is a unique virus strain. It mutates over time. Different viruses mutate over time, and your body finds ways to fight viruses, but it has to learn how to fight that virus, and then it won't ever get it again. Different viruses are protected by different means, and the coronavirus family of virus, or the COVID-19 specifically, is protected by a layer of fats that surround the virus. And you can kind of think of that like bacon, the grease of bacon. And we're going to use that analogy throughout this presentation today. But think about it like bacon is or the grease of bacon is surrounding this virus and protecting it. So what symptoms people encounter with this coronavirus is that roughly everyone encounters some fever symptoms, and about 80% of the people encounter a cough. So not everyone has a cough. So it makes it really hard to diagnose coronavirus from other virus because the symptoms are so common. People get flu all the time, or they get other types of colds that give them a fever, and they get coughs for those fevers as well as allergies or anything else. But what sets this apart is the shortness of breath. But only 30% of people get a shortness of breath, while 50% of people find some extreme exhaustion. So we need to be really careful in how we self-diagnose and make sure that if we encounter any of these symptoms, we take the necessary precautions that we're going to talk about. So again, almost everyone has a fever. Most people have a cough. A lot of people encounter some severe exhaustion. And then there's about a third of the people have a very significant shortness of breath. And that's what's dangerous. That's why we are talking about this disease now. The coronavirus, or COVID-19 as it's more specifically called, is spread by respiratory droplets. So as I'm sitting here talking right now, there are microscopic droplets that are being expelled from my mouth, as well as just breathing or sneezing or coughing. And those droplets contain the virus, and it is therefore spread between you and the other people. So I said we're going to talk about like bacon. So the virus is protected by a layer of fats around the side of it. So just like bacon grease is a fat. And as that bacon is cooked and that wonderful bacon smell is transmitted throughout the home, the virus is transmitted much in the same way. It is broadcast out of your body and is transmitted on dust and other things throughout the home. So you want to make sure that you keep adequate distance between you and the people around you. If you are exposed to the coronavirus, most people will contract the disease, and symptoms will start to appear usually in 2 to 14 days. So it really doesn't take very long. Sometimes it takes a rather long time, though, to start showing symptoms. The tricky part of that, though, is you're contagious in only 2 days to 7 days. So most often you are contagious, meaning you're giving this disease to other people before you even know that you have it. And statistics show that the average person is infecting 2.5 other people. So for every single person that's sick, they're going to give it to 2.5 other people. So let's just round that down and say that I am sick right now and I'm infecting 2 more people. Well, those 2 people are going to infect another 2 people each. So now I infected 2, they infected 2 each, so that's another 4. So then those 4 are going to infect 2 each. So then that's 8. So every time somebody else gets sick, the pace at which this virus spreads significantly increases. Now you may be wondering, how long does it take to feel better? And most people start to recover in about 7 days to 21 days. But since the virus is so new, there's not a whole lot of data, not a lot is known. The coronavirus, as I just mentioned, usually transmits from one person to 2.5 other people. You can see that in the top right corner on the screen. I'm sure you've heard of the H1N1 flu or the Ebola virus or SARS. Those are different viruses that are in the same family as this coronavirus. And H1N1 spreads to 1.5 other people, whereas Ebola 1.5 to 2, and then SARS 2 to 4. So let's just say that the COVID-19 spreads to 2.5 people, so it spreads faster than the H1N1 or the Ebola, and almost as fast as the SARS virus. So this is a significant thing, and that's why we're making a big deal out of it today, talking about it, as well as why the news continues to talk about it. This is just a graph showing, or not a graph, but a chart showing the different virus strains that are related to the coronavirus, the COVID-19, and the year they are identified, as well as how many cases worldwide since that time. So the COVID-19, as of about March 15th, had 137,000 cases worldwide. That number is significantly more than any of the other strains of this virus that are shown on this chart, including the Ebola, the SARS, the MERS. Those are all things that made the news pretty prevalently. What is good news about that is the fatality rate of COVID-19 is relatively low. There's only a 4% fatality rate compared to the 40% or 80% or 30% of some of those other ones. However, 4% is still too high. We don't want 4% to die. Imagine 100 people that you know. Pick which 4 of those are going to die. Let's just prevent that instead. So if you're exposed to the coronavirus, or if you're in a room with someone exposing you, up to 70% of those people that are exposed to the virus are going to start to show symptoms. And that range, 40 to 70, is very high because they don't know yet. They're still learning a lot about it, but it could be even higher than that 70%. Now imagine that you're in a room with 100 people. 70% of those are going to contract the virus. And then let's just say there's a mix of age groups. Well, for those that are between 60 and 70 years old, 3.5% of those are going to die. And then another 8% of those that are between 70 and 80 years old. And then for the people that are over 80, 15% of them are going to die. So if you're in that room with 100 people that are over the age of 80, so like a nursing home, for example, 70 of them are going to get sick and 15 of them are going to die. The other 55 that are infected and don't die are still going to need ventilators and need other assistance. So we have to make sure that we minimize the spread of this virus so those people can survive. One little bit of good news is the death rate or fatality rate is much lower among patients that do not have underlying conditions. So they're not already sick, they're not over the age of 60, and then it's believed to be under 1%. But 1%, earlier I said pick 100 of your friends and pick which 4 are going to die. Well, here's still, if everybody's healthy, pick one of those 100 that are going to die. It's too much. Too many people. Let's protect them instead. People with comorbidities, that just means other potential causes of death as well. And 1 out of 10 are going to die if they have other medical complications. So this chart is showing you the blue graph, or blue line, is showing you the number of people that are sick at any one point in time. So as the number of people increases, or as the number of people that are sick increases, we very quickly outpace the hospitals or the medical facilities' ability to care for these patients. So that dashed line is the number of people that the hospitals can treat at any one point in time. And again, that blue line is the number of people that are sick at any one point in time. So if we can delay the number of people that are sick, or so that people get sick at different times, then not everybody is sick at the same amount of time, or at the same time. So remember I said that it takes 7 to 21 days to start to heal, or to start to feel better. So then if you get sick and then you're starting to feel better when your family gets sick, then not everybody is sick at the same time. So we can bring down the number of people that are sick at any one point in time by taking some very basic safety precautions. So that's how all this affects us. Basically, if 70% of us get sick, then what happens if everybody gets sick on the same day? And if that happens, then there's only 3 people that are left working. If we don't mow the grass for 2 or 3 weeks at a time, it's going to suck when we come back to work. It's going to be 3 feet tall. We need to take some precautions to make sure that we are available to work. And we can do that by flattening that curve. Additionally, that helps the medical facilities, the medical community, to treat the people that are sick. So if only 1 new person gets sick every day, that means there's 5 people available. Out of the 13 on staff, we have 5 people available to work every single day. And that's a whole lot better situation than only having 3, especially when you consider that several of us are not trained in mowing. In this example scenario, the blue and yellow graphs or lines chart the number of people that are sick at a time. So, I'm sorry, the number of people working. So as the number of people that get sick increases, the number of people available to work decreases. So in the blue line, everybody gets sick on the same day. There's 13 on staff, and that drops us down to only 3 or 4 people available to complete the work. The yellow line, however, is the number of people that are sick at any point in time. If we can delay the new people that get sick to just 1 person each day. So if you don't contaminate your truck, then you're not going to get everybody else sick in it. And then they're going to get sick from a different source, but they're not going to get sick at the same time. On the yellow graph, we're able to keep the number of people working above our minimum needs. So we need 5 people to work every day, and 6 people to work every day. And if we can keep that, keep the number of people available above that, then we're in a better situation. So COVID-19, it spreads through water droplets, as we talked about. There's no vaccine to prevent the virus, so you're not going to go get a flu shot and prevent COVID-19. The best way to prevent it is to avoid being exposed. So it's spread by person to person. The water droplets, close contacts, touching hands that touched their face to your face, and things like that. When you breathe out this vapor that contains the COVID virus, then other people breathe that in. We talked about the bacon earlier. That bacon grease is floating through the air, and you breathe that in, and that's why you can smell it, because you're breathing it in. So the water droplets are being breathed into your body. You're taking those into your lungs, into your mouth, into your nose, into your eyes, and then the virus can infect you and use your body to reproduce. So there's some simple steps to protect yourself. Basically, you need to wash your hands. Wash your hands often with soap and water for at least 20 seconds, especially after you've been in a public place, like after blowing your nose, coughing, sneezing, doing anything to get water vapor from your face into your hands. 20 seconds washing your hands is the happy birthday song twice. Take the time to do that. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Most hand sanitizers do. But if your hands are dirty, if they have grease on them, if they have mud on them, anything like that, hand sanitizer is not going to work. You have to do it to clean hands. So if you don't have soap available, use water, get the dirt off of your hands, and then use hand sanitizer. Most people, or people on average, touch their face twice every minute. That's 30 times every hour. Avoid doing that at all costs. It's such a habit, you don't even know you're doing it. My face is driving me crazy right now because I'm talking about it. It makes me want to scratch my eye or something. But avoid touching your eyes, your nose, your mouth with your unwashed hands. When you touch your face, you're taking that virus off of whatever surfaces you've contacted and putting that into your eyes. You're also going in the other direction. If you're sick and don't know it, then you're taking that virus from your face and you're putting that out to other people. You need to avoid close contact with people that are sick. When you're breathing, you're contaminating them. So just don't do it. Put a safe distance between you and others. They're saying that distance is about 6 feet. We're going to go ahead and skip this, but this is a great video from the Centers for Disease Control on washing your hands. You can do a quick Google search for that, or I will include a link at the end of this video. There's a couple basic steps to protect other people. When you're sick, stay home. Don't go out into the public where you're going to infect everybody else. Put yourself in an isolated space within your home so you don't infect your family. Cover your cough and your sneeze. Use your elbow, use your shoulder. Don't use your hands. Clean your hands often. Wash your hands, basically. Wear a face mask. Anything that you can find is going to reduce the amount of droplets that you're expelling from your face. It's referred to as shedding the virus. We want to reduce what you're doing. Don't share personal items. Don't share a fork, a plate, a cup, anything else that you might share with a family member. Just don't do it. Now's not the time. And then clean and disinfect. So if you touch your face and then you touch the door handle of your house, you're contaminating that surface. If you touch your face and then your phone, you are contaminating that surface. Same thing in the opposite direction. Now, if you're out in public and you touch something and then you touch your phone and then you wash your hands, guess what? Phone's still dirty. You got to clean it too. When you are sick, call our office to let us know. The company policy says that you have to have a doctor's note. We are waiving that requirement. You do not have to have a doctor's note. Just stay home. We don't want you at work. We don't want you out in public. Stay home. Make sure that you stay healthy and that the people around you stay healthy, and even the people that you don't know, so that they stay healthy as well. You need to seek medical attention if necessary. You don't have to go to the doctor just because you have a minor fever or a minor cough. But if you are having trouble breathing or having difficulty breathing, call your doctor right away. Don't just show up at their office, because they need to know that you're coming and that you may have COVID-19. They might have you go to a different office. They might have you take other precautions to protect the staff at that facility, as well as the other patients that may be there for other causes. If you wear a face mask, you're going to greatly reduce what you're exhaling. The water droplets are going to get caught in that mask, and you're not going to contaminate as many people around you. And then basically you just need to watch your symptoms. Excuse me. Since there is no known treatment to kill the virus, you just need to address the symptoms. There's nothing that you can do just because you have COVID-19, but there are things to do for your fever. There are things to do for your cough, and there are things to do for your difficulty breathing. So if you're in a position where you can take care of yourself at home, or you have someone else that can take care of you at home, then do that. But seek the medical treatments necessary when you need those treatments. If you don't need them, leave them for somebody else, because there is somebody that needs them. You can discontinue isolation. You can go back out in public after you're not contributing, or after you're not contagious anymore. So when your transmission rate is thought to be low, basically after you have no fever, you have no cough, you have no difficulty breathing, when you have none of those symptoms for 36 hours or more, then you can come back out into public. But before you come back to work, call our office, let us know. That way we know you're coming. We can set up a crew for you and make sure that work is allocated to you appropriately. Some other things that you need to be aware of, that you need to be thinking about. You have to figure out ways that you're going to take care of your family when everyone is sick at the same time. Everyone in your family is going to get sick. You got to plan for that, and you have to make sure that you make the accommodations that you can take care of them when you are sick and they are sick. Make sure you have some meals prepared ahead of time, and the other supplies, that you have some Tylenol and fever reducers, and that you have water and maybe paper plates so you don't have to do dishes. Have enough groceries, have enough baby formula. I don't know, all the different things that you're going to need in your house. Now, if your family gets sick and you're not sick, or just your family can't go to work, can't go to daycare, can't go to school, how are you going to take care of your family while you work? Do you have arrangements set to be able to do that? And then what about when you get sick but your family is not sick? How are you going to care for them? You need to isolate yourself from them so that you don't get them sick. I said that everybody's going to get sick, but you don't want to be sick at the same time as them because you have to take care of them. And then you're going to be out of work for a week, 2 weeks, 3 weeks at some point through this. So you need to find a way to financially support your family. The government is doing some things, but that's not going to be everything. You need to contact the people that have the note on your car. You need to contact your landlord, your mortgage company, anyone else that you owe money to. Talk to them about the situation. They're going to work with you, but you need to bring it up now and say, hey, I need to make a half payment now, and I may need to make additional half payments. After that, then I can come back and start making my full payments and more so that you can repay those debts. When you do that, they'll be much more happy to work with you. So to come back and summarize, the avoid close contact with people who are sick. Don't get all up around them. Just give them 6 feet of space or more between you and anyone else. Even if they're not sick, you have no idea, so stay away. Cover your cough or your sneeze with a tissue and then throw it away, and then go wash your hands. Don't reuse that tissue, and make sure you're not touching anything else after that. Even though you had a tissue in your hand, you're still contaminating your hands. Don't touch your eyes, your nose, your mouth, anything, because you're getting whatever's on your hands into your face, and you're taking whatever from your face and putting it on other surfaces. So just don't do that, please. It's so easy to do, but try your best to avoid it. And then clean and disinfect frequently. Use Lysol. Read the directions. Use soap and water. Read the directions. Follow the directions on there. If you just spray Lysol up in the air, it's not going to do anything. You have to follow the directions on the bottle. And then when you're sick, and even if you're not sick, stay home to avoid getting sick, to avoid infecting other people. Yes, you will get sick eventually, but we want to make sure that not everybody gets sick at the same time. We want to make sure that there's enough hospital beds for you and your mother and your grandmother to all get the care that you need. And the number one best way that you can minimize or delay as long as possible, or minimize your potential chances of getting this virus, is to wash your hands. That will also keep you from spreading it to other people, even if you don't contract it. So wash your hands, sing the happy birthday song while you're scrubbing your hands together, and that needs to last for at least 20 seconds. Let me know if you have any questions. Otherwise, this will conclude this section of your training. Have a great day.